Good day, everyone. I hope you all are having a super sensational Saturday thus far. I am super excited and ecstatic to welcome you to our second annual Women's Health Awareness Symposium. And our theme is Mind, Body, and Soul. We have some phenomenal speakers who are going to grace the stage. And we want to make sure that you all are ready to get started. So if you all are ready for the show, then make sure to put some love in the chat. So put some hearts in the chat, put a high five in the chat, put a 1 in the chat if you're ready to go. And I also want to let you know that we are live streaming this right now onto Facebook. So make sure that you are able to get this out to your friends, have them to like it and share it. And you still have a few moments to go ahead and get your colleagues, your friends, your coworkers, families, all the people that you know and love and care about, to have them to join into this phenomenal event. Because I'm telling you, you do not want to have anyone miss this, because this is the symposium of all symposiums for women's health. All right, so I want us to go ahead and get started. So I want to bring to the stage someone who is absolutely phenomenal. This gentleman, I met him and immediately I knew that he had to be on our platform. So who I want to bring up, his name is Anthony Martinez-Bevan, and he is a chronic illness health coach, who blends his diverse expertise in nutrition, naturopathy, and clinical hypnotherapy. I'm going to get this right, you all. I'm so excited that I'm stumbling over my words. So let's start over, because I want to make sure that we give him his due process, because this gentleman is absolutely phenomenal. So Anthony Martinez-Bevan is a chronic illness health coach who blends his diverse expertise in nutrition, naturopathy, and clinical hypnotherapy to help clients transform their mind, body, and soul through an integrated health approach. Born in Metro Detroit to a Mexican-American mother and an Irish-Canadian father, his childhood challenges paved the way for a profound life journey. From surviving a near-death experience at 10 months due to a pertussis vaccine, to facing back-to-back diagnoses of HIV and cancer in 2017 and undiagnosed cancer in 2022, Anthony's body became a battleground of inflammation. His story symbolizes resilience and rebirth, advocating for a healthcare system prioritizing accurate diagnosis and emphasizing transformation beyond physical health. He shares insight into his holistic healing journey, promoting self-healing and unlocking limitless possibilities through spiritual enlightenment. And you can learn more at his website, detoxdayspa.com. Without further ado, I want to introduce to some and present to others Mr. Anthony Martinez-Bevan. Mr. Bevan, take it away.
Thank you. So if you can just send the share screen to me, and I can throw up a few slides.
You have the ability. Take it away.
Okay, can everybody see that? All right. So thank you for joining me today to discuss a topic that profoundly affects many lives, the estrogen enigma. Often known for its crucial role in the female reproductive system, it's a hormone that influences various aspects of health, transcending gender. Understanding its complexities, especially how it relates to chronic illness like cancer, is vital for both prevention and management. So what is the estrogen enigma? The term estrogen enigma refers to the intricate and often misunderstood roles of estrogen in the body. Estrogen is pivotal for regulating the menstrual cycle, reproductive system, and secondary sexual characteristics. However, its influence extends far beyond these functions, impacting cardiovascular health, bone density, and even cognitive functions. One of the most significant concerns regarding estrogen is its link to cancer, particularly breast cancer and endometrial cancers. Estrogen can promote the growth of some types of cancer cells. For instance, in breast cancer, estrogen can bind to estrogen receptors on the cells, stimulating their proliferation. This is particularly evident in hormone receptive positive breast cancers, which constitute about 70% of all breast cancers. Similarly, in endometrial cancer, prolonged exposure to estrogen unopposed by progesterone can lead to the excessive growth of endometrial lining, increasing the risk of malignancy. The estrogen dominance theory suggests that a relative excess of estrogen compared to progesterone can heighten this risk. Beyond cancer, estrogen imbalance is linked to various chronic conditions. In cardiovascular health, estrogen has a protective effect, helping to maintain the flexibility of blood cells and reducing the buildup of arterial plaque. Postmenopausal women who experience a drop in estrogen levels often see a corresponding increase in the risk of cardiovascular diseases. Bone health is another area influenced by estrogen. Estrogen helps to maintain bone density, and a decline in estrogen levels, such as menopause, can lead to osteoporosis. Additionally, estrogen plays a role in mood regulation and cognitive function, with imbalance potentially contributing to conditions like depression or Alzheimer's disease. Let's get into some of the contributing factors to estrogen imbalance. One of the significant contributing factors to this and other health issues is exposure to toxins found in everyday personal care products. And I'm going to go through some common products and the toxins they may contain. Lotion and creams may contain parabens, which are preservatives with estrogen mimicking properties. Parabens can disrupt hormonal balance and have been linked to breast cancer. Deodorant. Aluminum compounds used in antiperspirants can mimic estrogen and have been associated with breast cancer. Biphthalates, often used in fragrances, can disrupt endocrine function. Makeup. Cosmetics often contain heavy metals like lead, as well as parabens and phthalates. These substances can accumulate in the body, disrupting hormonal balance and increasing cancer risk. Tampons. Some tampons are bleached with chlorine, which can create dioxins known as endocrine disruptors and carcinogens. Tampons can contain pesticide residues from non-organic cotton as well. Bras and clothing. Synthetic fabrics and dyes can contain chemicals like formaldehyde, which is a potential carcinogen and endocrine disruptor. So what are some ways that you can effectively detox from some of the toxins that I just went through? Well, you can increase your fiber intake. A diet rich in fiber helps the body to eliminate toxins through the digestive system. Whole grains, fruits, vegetables, and legumes are excellent sources of fiber. Hydration. Drinking plenty of water supports the liver and kidneys in detoxifying the body. Sweating. Activities that induce sweating, such as exercise and saunas, particularly infrared saunas, because they penetrate beyond the surface layers of the skin to get to that real cellular level detox. Help the body to expel toxins through the skin. And how do toxins get out of the body? There's multiple ways: sweat, urination, bowel movement, breathing out. And I'm going to go through some supplements that you can incorporate into a nutritional protocol for yourself. Chlorella and spirulina. These algae supplements bind to heavy metals and aid in their excretion. Milk thistle supports liver function, enhancing the body's natural detoxification processes. Dandelion root is another great option as well. Activated charcoal. This binds to the toxins in the gut, preventing their absorption. There's tons of binders out there, but activated charcoal is a great one. Diatomaceous earth, shilajit, zeolite. but you just want to be careful. You want to make sure that you understand how your body detoxes so you don't go into hurt symptoms. And then, of course, avoiding further exposure. You want to choose natural and organic personal care products free from known toxins. Look for products labeled free from parabens, aluminum, broccoli, cauliflower, Brussels sprouts. Support estrogen metabolization and detoxification. And then garlic and onions. These contain sulfur compounds that support liver detoxification pathways. All right, so we're going to quickly go through the impact of major toxins on hormonal balance. Heavy metals like lead, mercury can interfere with endocrine function, leading to hormonal balances and increased microplastic. These tiny plastic particles can lead to harmful situations that mimic estrogen and disrupt hormonal function. A lot of times I'll see women drink flimsy plastic bottled water, and you have to think that that heats up, it cools down, heats up, cools down, heats up, cools down. You're drinking plastic water. So you should either be drinking out of a glass container, or if you have to, something that's like BPA free plastic. But that flimsy plastic is not going to do your body any good, especially if you're in a cancer or chronic health situation. So cut it out. And then let's go through quickly addressing estrogen issues through nutrition and supplements. Given estrogen's wide-ranging impact, managing its levels through diet and supplements offers some promising strategies. And here are some approaches. Plant-derived compounds found in organic soy, flaxseed, legumes can help balance estrogen levels, particularly beneficial for women in menopause. Vegetables such as broccoli and cauliflower contain compounds which support estrogen metabolization. Fiber-rich foods promote the excretion of excess estrogen, okay? And that's really important. Your body has to be able to utilize it and then get it out. Omega fatty acids. So you're going to find that in salmons. You also might want to supplement that in as well. Typically, it's in the liquid form, so the body's able to immediately use it due to its liposomal technology. And this is going to reduce inflammation and help support hormonal balance. Vitamin D and calcium. This is critical for bone health, and vitamin D helps with more effective calcium absorption. So the two really need to be taken together. They should not be taken separately. If you're just taking calcium separately, then you're going to end up with an overload of calcium in your body that goes undigested. So you have to make sure that you're looking at things in the right combinations when you're approaching detoxification. Herbal supplements like black cohosh, red clover can alleviate menstrual symptoms. And then DIM supports healthy estrogen metabolization. And if anybody's interested, you can send me a message after. I can get you access to clinical grade DIM. And then methylated folate aids in DNA synthesis and repair and supporting detoxification processes. And then, of course, magnesium is essential for hormonal regulation and managing symptoms of estrogen imbalance. It plays a role in 300 enzyme processes inside of the body. And if you don't know, the body is a machine. It either breaks down or converts. You need an enzyme and a mineral cofactor for all the biochemical processes to occur inside of the body. So in a cancer or chronic health situation, your liver, your gallbladder, your pancreas, also known as the accessory organs, are in inflammation. They're responsible for things individually, but together they're responsible for enzyme production, storage, functionality, and release. So again, you need an enzyme and a mineral cofactor for all the biochemical processes to occur inside of the body. That's everything. And when you're in a cancer or chronic health situation, it's like dead calm inside of the body. So you have to kind of, it's like your car has the battery is dead and you got to jump it. All right. So last, we'll talk about gut health. A healthy gut is crucial for hormonal balance. Probiotics, such as those found in yogurt, kefir, supplements, help maintain healthy gut flora. Prebiotics found in foods like garlics, onions, bananas, artichokes, uh, feed the beneficial gut bacteria. So prebiotics feed probiotics. You should not just be taking a prebiotic on its own without a prebiotic, or eating prebiotic foods when you take that probiotic, so that way you can help with the absorption. Remember what I said about the vitamin D and the calcium. They need to be taken together for maximum absorption. So when you're creating a nutritional and detoxification and rebuild plan for yourself, you need to be considering all these things. So the estrogen enigma highlights the hormone's dual role as both a protector and a potential risk factor in various health conditions. By understanding its complexities, reducing exposure to harmful toxins, and leveraging dietary and supplement strategies, we can better manage estrogen levels and reduce risks associated with its imbalance. So let's continue to educate ourselves and others, making informed decisions that promote health and well-being. Thank you. So if anybody has any questions, you can get in touch with me by visiting my website, detoxdayspa.com. You can connect with me on my social media on Facebook and Instagram. You can find me at Detox Day Spa. And on TikTok, you can find me at Detox Day Coaching. That's Detox Day Coaching, Detox Day Talk. info@detoxdayspa.com.
Excellent, excellent. That was an absolute phenomenal speech and presentation. And if you could do me a huge favor, Mr. Bevan, I believe you have to stop sharing. All right, awesome sauce, cool beans, excellent, excellent. Thank you all so much. Now, I don't know about you, but you all put some love in the chat. Give some round of applause in the chat, some hearts in the chat. And if you are watching live on Facebook, make sure you're commenting, because what Mr. Bevan just talked about was so instrumental when he talked about the role that estrogen plays. And I took some notes myself, you all. So I hope you all are taking copious notes. I didn't say at the beginning, but if you do not have your pen and paper, we call that getting in the gap, grab a pen and paper, then you need to do that right now.
And if anybody wants that, they can email me. I'll send my talk to them.
Awesome, great. Thank you again for that, Mr. Bevan. So absolutely. And I love how Mr. Bevan made the comparison of our bodies to cars. Because a lot of times we know we go get our routine oil changes, we go get the car washed, we do all those things to make sure that our car looks good and feels good. But are we doing the same thing for our bodies? And that's why we're having this Women's Health Awareness Symposium today, to make sure that we treat ourselves better than we treat our cars, because cars are replaceable. We are not. All right. So thank you again so much for that, Mr. Bevan. All right. Next, we have coming to the stage this young lady. I had the opportunity to meet her through a mutual friend. And so I'm going to introduce to you all Dr. Shalina Nevins. So Dr. Nevins embarked on her healthcare journey as a medical assistant in Detroit, Michigan. Progressing in her career, she earned an associate's in registered nursing from Breckenridge School of Nursing and a bachelor's in registered nursing at Chamberlain University. During her studies, Dr. Nevins served as the assistant director in nursing and became a certified life coach. She later obtained her master's in registered nursing and doctor of nursing practice with a minor in nursing education. She also earned her family nurse practitioner degree from Northern Kentucky University. Dr. Nevins specializes in wellness therapy, offering services such as life coaching, self-care management, and mentorship. With over 30 years of experience in healthcare, she brings a wealth of knowledge and expertise to her practice, including neurology, ADHD, anxiety, and depression, emphasizing a holistic approach to care. Committed to service, Dr. Nevins is a member of the Lambda Chi Chi Eta Phi nursing sorority, dedicated to serving humanity. As a mother of 3 and a wife for 20 years, she applies her professional insights to her personal life, striving for whole life balance and promoting happiness and wholeness in others. it is my pleasure and privilege to introduce to you all Dr. Shalina Nevins. Dr. Nevins, take it away.
Hello, everyone. So glad to be here. I am going to bring up my screen here, share screen with you real quick. And I just really want to introduce myself from a functional medicine point of view for integrated healthcare. Being here with you actually helps for me to relax in the specialty even more. That is because I became into the specialty because I became a patient. I became a patient via my own story. But I'm going to introduce to you what integrated medicine is. And it's a growing approach in healthcare. It really offers a patient-centered approach. It's the root cause search of what is going on with chronic disease in people. A lot of times, once they find out they have a condition, they've been in it for a long time. And so what we end up doing in integrated healthcare, I integrate with behavioral health and I provide primary care. And we come together and create a treatment plan for people who actually are shifted way on one side or shifted way on the other side. And so by examining the entire life and complete medical history, we find underlying causes that may be contributing to health problems or chronic disease, such as nutritional issues, stress levels, hormonal imbalance, environmental influences, and genetics. We look for root cause of the disease, examining how all systems of the body work together so that the patient can understand. That offers autonomy to the patient. What we don't want to do is keep people in the blind about their own health. I found that to be very unfair. My story is what brought me there. So I found out I had a left occipital meningioma, which is a benign brain tumor. And I was off balance. I couldn't really bring it together. I'm nursing, I'm taking care of other people, I'm at the bedside, and I'm feeling like the room is tilted, but it's not. And then some days I feel like I'm tilted, but I'm not. I'm standing straight up. And I went to the doctor several times. What's wrong with me? What's wrong with me? Blood work looked fine. Overall health looked fine. Everything was unremarkable. But I knew something was wrong with me. So they prescribed me Wellbutrin. Well, I'm a nurse at this time. I knew what Wellbutrin was. It's an antidepressant. I'm not depressed. I know how I feel. What's the next step? So what I did not enjoy in my journey was that it was a graduated process in order for them to find out what was wrong with me. When I, the patient, am telling you exactly how I'm feeling. So the young lady that you saw on the previous slide here, down at the bottom there, that's not what you see in integrated healthcare at all. That was me. And that's not okay. So that's why I'm passionate about this, because we have to listen to the patient. They've been in their bodies their entire life, right? And that's where we should start gathering information. And then we add labs. And then we add we incorporate other things like imaging. And then we start, now you dig. And that's the approach that we take in integrated care. We begin to start from the patient. What's happening to you? What's different? When did this happen? When did it start? Even so far back where you were a vaginal birth or a C-section, all of this matters. So I never took Wellbutrin, was not going to take it. The prescription just expired at the pharmacy. I knew something was wrong with me. I found out because I was at work one day and the charge nurse there that day said, why do you keep stopping? She was walking behind me, and I kept stopping and touching the wall, stopping, touching the wall. And so I began to say, it's not fair for me to try to take care of people like this. So she said, okay, you need to go downstairs to the ER. So I went down. They gave me a CT scan. It was the very first time I was imaged. In a whole year, it was the first time I had an image. They gave me a CT scan, and when they told me I needed an MRI, I knew there was an issue, just because of the line of work I'm in. And when I had the MRI, they came and told me that I had a brain tumor, and it appeared to be what they call a meningioma, and we discussed it. 1 whole year trying to medicate me. Where would I be if I had done that? So that's what I want to stop happening to people, because we have to be able to be heard, and at that same time advocate for yourself, create your own preventative care. So prime example, this is what they told me, I either had ADHD or I was just depressed. I was happy. I had bouts of depression in my past, and I knew the difference. That was not the moment. I knew something was wrong with me. So what I want people to not have to do is go in and rely 100% on what anybody says. We deserve an opportunity to speak for ourselves. We deserve an opportunity to ask questions. We deserve an opportunity to have time spent with us. And that's not 15 minutes when your body has changed on you. So I have made it my life's passion for people to understand themselves and demand to be heard about it. I don't think it should be taken lightly. I think that in integrated health, we spend our first visit is an hour and a half, because we should discuss you. I want to talk about you. Tell me about you. And I think that you can't do that in 15 minutes. I just don't think we can do that. Even greater than that, whatever I told you in 15 minutes, hear me. And so my own personal experience brought me there, and then taking family members to the doctor brought me there. And now seeing my own patients keeps me there, because it's way too prevalent. I have a little bit of statistics for us. 57.2 million physician office visits with mental health as the primary diagnosis is what we're looking at, according to the CDC. 57.2 million. So that means they're going to get a prescription for a mental health condition and they're going home. Right? Did they have an hour and a half or even an hour to discuss that? To say what that felt like? Nope. And then they'll get a referral to a therapist. Those two people are in two different areas. There will be a consult note sent back and forth, and they're not partners. 5.8 million visits to the ER with mental disorder, behavioral health, or neurodevelopment as the primary diagnosis. That neurodevelopmental, that was me. That was me. By this point, I would have my whole cognitive self affected. I would be way off. So I'm grateful that what I learned about myself pushed me into a place to be able to teach to others. And I want that heard. I want people cared for in a way where they have a voice, and especially people with mental health disorders. They're not heard. They're not They can think, and they're very intelligent. It's just a mental health disorder. So I thank you guys for visiting with me. I thank you guys for listening to me. I really am. I want the push to be so heavy for this. I want the push to be very heavy. One other thing I like to mention in healthcare is ovarian cancer. One thing a lot of women don't know is that there is no preventative test that we do, like we do our annual mammograms. We do at a certain age, we start that. At a certain age, we start colonoscopy. At a certain age, we start getting our pap smears. What about our ovaries? By the time we reach stage 4, it's a done deal, right? So the symptoms to get there, it's very quiet. It's silent. We don't feel it happening. And then when you get there, it's no preventative measures. You can get a transvaginal ultrasound. Do your own preventative care by asking for one. Ask for one. When you go get your pap and you are of age, 40 and up, I would say, tell them, I also want a transvaginal ultrasound. Look at these ovaries. They're quietly getting us into situations. All right, guys, I'm passionate about it. My face gets real serious because I mean what I say. But I love you guys. Thanks for being with me, and I appreciate your time. Now I'm going to figure out how to stop sharing. There we go.
Oh, wow. Oh, my goodness. I don't know about you all, but these first 2 speakers have already set the pace. If you could not hear the resounding, I just kept hearing as Dr. Shalina was speaking, and that is, we know our own bodies. And I was seeing that in the chat over and over again, people saying it in different ways. I saw that we are the CEO of our own bodies. We know ourselves best. I put in there as well that we know our own baseline. So yes, when we have those appointments and we go in to see the doctors, whether it's mental health, me being a licensed mental health therapist myself, or whether we're going into a primary care situation, they only have this amount of time, right? And we have to make sure that we are being heard. And what I wrote down in my notebook is, don't stop until you are heard. You know you best. Don't stop until someone listens to you, because that could definitely make the difference between you being here or not. So thank you so much for that, Dr. Shalina. We really appreciate both of those presentations to this point. And now we're going to continue on. So if you all are enjoying what you are hearing right now, please, please, please share this. Like this, share this if you're on Facebook. Like this post, share this post to someone else, so that way they can get this information. Invite them into the Zoom room, so that way when we get to our Q&A, you'll be able to get your questions answered. So, all right, without further ado, I want to bring our next speaker up to the stage. The next speaker, I have the pleasure and privilege of knowing her personally. We met in a business community, and this young lady is absolutely dynamic. And her name is Dr. Katrina D. Hall-Smith, loving that D, obviously. And she is a family practice physician and retired Army veteran with 3 combat tours and 32 years of service. First of all, you all put some love in the chat for that alone. Born in Knoxville, Tennessee, she earned a BS from the United States Military Academy, MPH, from the University of Texas Medical Branch, and Doctor of Medicine from Howard University College of Medicine. She received board certifications in both aerospace and family medicine. Upon retiring from the military, she co-founded J225 Ventures, a consulting business helping busy adult children with elderly parents navigate the challenges of providing for their care. She and her husband are blessed to have 5 wonderful parents, 6 adult children, and 10 grandchildren. Absolutely amazing. All right, you all, without further ado, I want to bring to the virtual stage Dr. Katrina D. Hall-Smith. Take it away.
Good afternoon, everybody, and thank you, Dr. Michele. I really appreciate that. Let's see. That's part of the video. Okay. I'm going to go ahead and share my screen and hopefully give you guys a little bit of additional motivation here. Let's see if this works. Do you know what that means, man? INDEPENDENT. Do you know what that means? All right. I don't know if that worked. I hope it did. Let's see. Coming back, coming back, coming back. Okay, can you see my slide now? Yes? Okay. So reason why I wanted to start out that song was because growing up, I mean, I've always considered myself to be fairly independent. And so growing up, I wanted to do what my mother raised me to do, which is be an independent individual, not depending on anyone for assistance for things that I could do myself. And so being self-sufficient and going forth and doing things like my mother did. She was an amazing trailblazer in her field and a terrific role model. Well, just like that individual or independent role model, I found myself doing lots of things that I felt like were instrumental, and I felt like I was being fairly successful. So when I found myself sitting in an exam room after my attending, this is during my second residency, but after my attending had told me we need to talk, I was like, what in the world is going on? I was extremely apprehensive. I was scared actually, because I was like, why is my attending coming to me and telling me that why is my attending coming to me and telling me that we have to talk? Well, she was coming to me because she was about to tell me that I had just failed a rotation. Failing a rotation in family medicine is not what I had in mind after doing 50 years of living for 50 years and doing exactly what the Army had asked me to do at that point for 25 years. I was finally at a stage in my life where I was doing what I wanted to do. I wanted to learn how to take care of patients from cradle to grave. And like Dr. Shalina said, I enjoy speaking to patients and giving them the time to be able to express themselves and basically tell you what's going on with them. So now at the time period where I'm finally getting a chance to be able to do what I really, really want to do, what I've been yearning to do since the time period I was a child, now that's all in jeopardy because I'm about to fail a rotation. What's going on? I'm a person who at this stage, I had been in charge of hospitals. I had been deployed. I had done medevac and transporting people from point of injury, like when they're injured on the ground, and transporting them to a forward surgical unit, from the forward surgical unit on to the level 3 treatment facility. I've done all of these things. So it's like, how in the world am I finding myself in a situation to where I'm failing? That was just unbeknown. I mean, that was blowing my mind. And I was like, what has happened? Well, fortunately for me, by the grace of God, this was a time period where I had to come out of that independent mode and I had to ask for help. I had to figure out what was going on. I had an attending whose wife was a psychiatrist who happened to work with child and adolescent medicine, and she specialized in ADHD. And so she, over time, pulled me aside, and we were able to figure out what was going on. But I had to ask for help. And so I say this to you because I know many of you on this call and on this at the symposium are professional women, and you're used to being very successful at what you do. That's why you do it. But if you find yourself in a situation where things are not, just like Dr. Shalina said, where things are not going the way they're supposed to, and you're not your usual self, you've got to ask the question and you've got to ask for help. I'm going to tell you a little bit about ADHD, especially in females and women, because a lot of times it's not diagnosed as children, primarily because women with ADHD or children, females with ADHD, generally do not have the same presenting signs and symptoms. And so it kind of gets overlooked. Rather than being hyperactive, they're usually inattentive. And it's usually overlooked and they don't get diagnosis and they go on. But in my particular case, what happened was when I had the combination of high stress, lack of sleep, low estrogen, and ADHD, that began to start to decrease my ability to be able to perform. ADHD in women usually presents as it presents in professional women. You find symptoms such as inattention, forgetfulness, disorganization. It can also impact your job performance. And it makes it difficult to maintain your focus during meetings and allow you to, or makes it more difficult for you to do follow through. It's okay. I'm not worried. If you guys, if you can't see my slide, it's just one slide telling who I am. So I'm just talking to you based off the information. The other thing is it can also impact career advancement in professionals. So the cumulative impact of all these challenges can hinder career advancement. And the thing that resonated the most with me is, as a professional woman with ADHD, I did struggle with imposter syndrome because I started to go from someone who had a very high self-esteem to it affecting my self-esteem because I knew that I wasn't performing at the level that I was used to performing at. And that also caused me to not pursue some of the more, let's say, higher profile, higher or more demanding type jobs because I didn't think that I could do the job. So why am I telling you guys this? I'm telling you this because I want you all, if you have things that are not going well, just like Dr. Shalina said, if you have things that are affecting you adversely and you know that something is wrong, although you may not know exactly what it is, seek advice and help and demand to get the answers. Again, I was fortunate. I had people around me who were willing to work with me and help me identify what it was so that I could go on and be successful. But I really want you guys to do the same and not just ignore these signs and symptoms. Ask for the help, get the help, and continue to be the phenomenal women that you are. And I'm going to end with something that I always like here, if I can.
She got her own house. She got her own.
Anyway, it was going to be Mary J. Blige just fine, because it goes on to say that she is just fine. She's working through all of the issues that she has, and she's doing just great. So thank you guys for the opportunity, and I hope this was helpful for you. I'm going to stop sharing my screen. And turn it back over to Dr. Michele.
Awesome, awesome. Can you all hear me? All right, excellent, excellent. Just want to make sure. All right, cool, Basil. Listen, thank you so much for that. I know sometimes technology can or cannot be our best friend, and it can create some challenges. So we were not able to see the slides, but Dr. Katrina, what she conveyed to us superseded us not being able to see the visual aid. And again, bringing home another point that we know ourselves best. And when we have more than one diagnosis, when we find ourselves with comorbidity, then it is that much more important for us to be able to get the help that we need, let our voices be heard, and have someone who can be in our corner and help us with our health journeys. So thank you so much for that, Dr. Katrina, for being transparent, being very transparent. So this is one of those cases where you have a provider who is a client, a patient, and also a helper in the helping medical industry. So thank you so much again for your transparency and for letting us know and letting us look into your life. So thank you so much for that. All right, we have one more speaker before we go to break, you all. This young lady, I had the wonderful opportunity to meet her through a mutual friend. And we met at a virtual coffee, and she was absolutely mesmerizing. And I said, okay, you know what? Your story needs to be heard on this platform because it's going to bless someone. And if you all are feeling right now that you've had some additions to your life, that this symposium, this second annual Women's Health Symposium, the mind, body, and soul, if you are finding that this has added value to you this morning, put some love in the chat. Let's see some hearts. Let's see some thumbs up. You can use some emojis, put some threes in the chat. 3 is my lucky number, my favorite number. So go ahead and show some love and let us know that you are receiving some value today. Additionally, make sure you like this and share this if you're on Facebook watching this so that someone else can also receive the same value. All right, without further ado, I want to introduce this young lady to you all. So Kimberly Willis is a fighter. Being a breast cancer survivor, she has successfully operated 2 businesses, 49 Rows, a fashion boutique, and Survivor's Corner, which caters to the cancer community, like her podcast, Survivorware, and more. She is a 3-time author, wife, mother of 4, and more. Kimberly knows the power of our words, our emotions, and the need to not only survive, but to thrive. Kimberly is also a proud member of Michigan Association of Female Entrepreneurs and National Association for the Advancement of Colored People. I want to introduce to them and present to others, Miss Kimberly Willis. Make it to the stage, young lady. Let's go.
Hello, everyone. Thank you, Dr. Michele. Can everyone hear me okay? Thumbs up if
Loud
you
and clear.
can. Awesome. Thank you so much for having me here. I'm truly honored to be amongst all these dynamic speakers and amongst all of you who took time out of your day to come today. I don't take it for granted. As she read my bio, as you know, I am a very busy individual. So I'm just thankful that, we're all taking the time to really bring awareness to women's health and how important that it is. And just to kind of reintroduce myself again, I am a financial coach. So that's one of the things I forgot to put in my bio, but I do that as well. But I'm a wellness advocate, and I became an advocate because I had to advocate for my own life. Being a stage 3 breast cancer survivor at the age of 34, I did not have the gene, nor did I have the family history. So I had to learn how to really navigate this cancer journey at a very young age. So I'm really advocate because really self-detection saved my life. Being under 40 years old, there was no need for me to get mammograms. Again, I don't have the history. There was really no need for me to really see about that. But because I remember what a nurse told me when I was 18 years old, to make sure that you check yourself and pay attention to your body. And if anything seems off, you see about it. So when I felt that lump in 2017, and I was like, okay, I have to go see about it. And my cancer journey was an interesting journey because being at 34 and was diagnosed as stage 3, I had both DCIS, but then I also had invasive ductal carcinoma as well. So I had 2 different forms of breast cancer. And I had to have the whole works thrown at me. I had 15 rounds of aggressive chemo. I've had 6 weeks of radiation. I had multiple surgeries. Again, doing all this at 34 years old. My youngest child was 1 at the time. My oldest was 11. My husband became a pastor literally the same time. So really just trying to figure out everything that was going on. My grandmother passed the same month that I found the lump. And I'm just really just trying to figure out, okay, what's happening with life. And with being a survivor, I really say that cancer is more than just a physical disease. It's an emotional and mental disease too, because you're trying to figure out what's going on. I know this one famous author, she talked about, survivors don't have the time to figure out to ask, why me? We have to really figure out what's next. What do I need to do now? Really got to put on the gloves and you really have to fight. So as I talk today, I'm going to really talk about action, which is going to be our acronym for my time today on the different things that you need to do while you are fighting. But to go a little bit back into my story, not only am I dealing with, I had to deal with my own cancer journey, I also have to deal with my husband. My husband is over a 10-year cancer survivor. His is incurable. And so not only am I a survivor, I'm also a caregiver as well. But then also on top of that, my parents had dealt with cancer the same time as I did. With me battling in 2017 around May, my father was diagnosed with bladder cancer around August, September, and he ended up passing away in March of 2018. Literally right after he passed away, my mother then had stage 4 lung cancer, and then she passed away 82 days after him. So with trying to really understand the purpose of it all, of, being the only survivor out of the three of us who had cancer, I really wanted to make sure that all of us are making sure that we are advocates, paying attention what's going on with our bodies, and going to the next steps with everything. So our action steps is going to be the acronym ACTION. And A is going to be, you need to ask questions. You really need to not be afraid when you go to the doctors. Sometimes you could feel like you're another number when you're inside of a doctor's office because they're seeing so many patients. But that is the time to make sure that you are jotting down your information and making sure that you don't forget it. But then you're getting everything addressed that you need to do, because who is going to deal with the consequences if you don't get your questions answered? You are. So it's very important to make sure that you are asking the questions that you need. There's no question that is too dumb or too smart. You really need to make sure that you understand and arm yourself with education, what's going on. Google could be your best friend and it could be your worst enemy. Sometimes it could give you way too much information that you don't understand. So that is the time to ask your health professional, hey, what's going on? I kind of want to know what's going on so we could work together on the treatment plan. I don't look at going to the doctor's office as me just having to listen to everything that the doctor says. He is there or she is there to give recommendations. And I think should be a marrying of the two. As they're interviewing you, asking questions about your health, that is your opportunity to interview them to make sure that it's a good fit on your health journey. Because again, dealing with cancer or any other health issue, it's more than just the physical thing. It's an emotional thing too. Stress kills. So you want to make sure that the healthcare provider that you're dealing with, as well as your environment, is in a more positive space. So then you're able to go to the next step. But then also you need to ask your family the family history. You know, when I got cancer, I knew certain things, but then that was the time where I started finding out that another family member had prostate cancer, another member had high blood pressure and things like that. And those questions are very important because it could tell a story. There's certain screenings that you can go for to make sure that, hey, you can catch something early, or if you did have a history of breast cancer, there's different things that you can do to help prevent it, or at least be able to catch it early, God forbid, if it does happen. The next step that you want to do for C is a caregiver. And by definition, caregiver means that you really are helping someone or you're getting paid to help someone in their health or whatever that they need. But I also think that being a survivor, you are also a caregiver to yourself. As a caregiver, it's easy to see what the needs of the other person is, but it's harder to see what you need for yourself because you can't see inside your body. You don't know what's going on. And in fact, that's some of the reasons why we ignore certain things, because we don't see it. That is the time to feel what's going on inside of your body, really paying attention to, not just shrugging it off, not just saying, okay, you know what, maybe I was working too hard, but really taking the time to really feel and understand what's going on with your body. That is a form of self-care. It's possible to be a giver and a receiver all at the same time. So you want to make sure that you're giving yourself that self-care, making sure that you're taking your medications. That's a form of self-care. Making sure that you're going to your doctor's appointments. And again, if they're recommending you to get surgery, and after your research and you are in agreement that you're doing those things, to make sure that you're going to the next step. But it's very important that you are giving yourself that self-care and being that caregiver for yourself, as well as how you're doing it for others. Next, for T is time. Time can really just help heal different things and really give yourself grace through the period. Being now 7 years out from having cancer, I really had to give myself time to heal emotionally and even physically. Your body goes through traumatic things when you're going through cancer, and things don't just heal right away. Just like if you just given birth, it takes time for your body to kind of get back to normal. And honestly, I'm finally starting to see the other side of my health. I'm still on tamoxifen. I have to take that for up to 10 years. I just got off of a one shot that was causing body aches and different things like that. So as time goes on, things do heal. And then really it's about giving yourself grace. Sometimes we could get really frustrated with ourselves because we remember how our bodies were and how our health was, our mental space, emotional health was prior to having whatever health challenges that you're going through. And then we're ready to jump right back after we had the surgery or after we had chemo, and ready to go back to normal. It doesn't always work that way. Chemotherapy in particular not only kills bad cells, it also kills good cells. So your body is really trying to figure out what the heck just happened to me and to go from there. So you really got to give yourself time and the grace to be able to forgive yourself. And it's really not really forgiving yourself, but forgiving the situation that has happened to you to be able to go to the next phase. Next is inspiration. I'm really big on motivating yourself because, again, dealing with cancer or dealing with diabetes or dealing with any other health challenges, AIDS or HIV, you can throw yourself in a depressive state. Or even some of the medications that you take could also throw you into depression. And you really want to make sure that you have a community of people that is going to support you, a community of people that is going to encourage you, especially on the days that you can't do it yourself. I had my church family. I had my friends. I've had my family that rallied around me to make sure that they were there to help me emotionally through this journey with cancer, especially with losing my parents in the way that I did, still dealing with my husband, dealing with cancer. You really have to find the silver lining of things. Now, I'm the type of individual that likes to look at things half full instead of half empty. Things could be a lot worse. There's someone who has a more devastating story than me, and for me, I could have a more devastating situation than someone else. But whatever the situation is, I always look for the light at the end of the tunnel because I know that if with my faith with God, if he has brought me to this situation, he's able to get me out. And no matter what your faith is, or even if you don't believe in something, I always believe that you need to find whatever inspiration you have to be able to motivate you to get you to the next phase. Next, for your O is to be observant, to really pay attention what's going on around you. Again, um, finding a lump, knowing what's going on around you. You know, with my daughter, she's a senior in high school and she's getting ready to go off to college. And I really, every time that she goes out, I tell her to pay attention to her surroundings, to make sure that she's keeping herself safe. We're really the same thing as going on with our health. We want to make sure that we're being observant, that we're going to our annual physicals to make sure is our blood levels, our cholesterol levels in line and things like that? Do we need to make dietary changes to make sure that we are doing better? Or is our water intake are doing well? My primary is always saying, okay, Kim, you need to make sure that you're drinking at least half your body weight because that's going to help all the medications that you're taking, the spasms that you're dealing with, and just making sure that you're just putting yourself in a better situation. But if you're not being observant to your body and not paying attention, you can potentially put yourself in a disadvantage or catch things too late with that. And even if you did catch something too late, that is not the time for you to beat yourself up. It is the time for you to fight. It is the time for you to just get to work and then now make the changes that you need to do. But then to finish our action steps, the end needs to be no. Sometimes you have to know when to say no to things. Um, I'm really all about harmony and making sure that whoever the relationship it is, if it's with the doctor, if it's with medications, it has to make sense. if the medications is not working properly and it's causing more um, risk than benefits, we got to go back to the drawing board. I remember after I finished my active treatment, which was a whole year long, it went from May 2017 all the way to May 2018. And my treatment was to take some aromatase inhibitors to, again, lower my chances for the reoccurrence of breast cancer. I went through 3 different drugs because I was starting to fall. I was starting to hurt myself. It was just really, it wasn't a good fit. But the good thing about my doctor, he listened to me, and then he allowed me to make changes until we found the home with tamoxifen. And listen, tamoxifen is it's a good evil to have. It's helping keep cancer at bay, but then it also has its own side effects. However, but out of all of those drugs that I was on, that happened to be the best fit for me. But again, for me to be able to say, you know what, no, this particular drug wasn't working for me, it helped me to advance to the next stage. So you have to be able to vocalize what is not working for you, because your doctor doesn't know exactly what you're feeling. Document it down, write it down, let them know, hey, this is what's going on, this, and this on this day. Since having cancer, I've been diagnosed with severe asthma, and part of it is done from radiation, but then part of it is just done from, I don't know, but but I still take a positive spirit onto my health challenges. So even though that there's some days I can't get out of the bed, even though there's some days that I really have to fight just to be able to be with my family, I know that being an advocate for not only myself, but really giving the tools and resources for others is really going to allow them to be able to feel more self-fulfillment, as far as knowing that I'm going to be okay through the end of the journey. And I feel like I could be the poster child and letting you know that no matter what gets thrown your way, you're going to be able to make it to the next steps. Yes, you're going to be able to deal with um, different trials and tribulations. Life is going to happen to you, but it's really about, what is your attitude going to be when it hits it? Are you going to just fall by the wayside, or are you going to strap yourself by the bootstraps and get to work, and let's, get to the next phase? Trouble doesn't always last always. And I am living proof that there's life after cancer. You're able to thrive after cancer. You're able to, even with pain and everything that's going on, you're still able to keep going on. So I encourage those who are going through cancer, those who are going through different health challenges, continue to fight and continue to just know that tomorrow's going to be a better day. Thank you for having me.
Absolutely phenomenal. You know what, Kimberly, that was absolutely amazing. And I know everyone in the audience, especially here in the Zoom room. If you're not in the Zoom room, I'm telling you, this chat has been lighting up the whole time, and it is continuously lighting up. And I love our people who are in the audience who are emphasizing the action. That was absolutely amazing. First of all, I love acronyms. And action, ask questions, C, caregiver, T, time, I, inspiration, O, observant, and N, no. Knowing when to say no to keep your harmony. Those were so important. And knowing when to say no when there are certain things that may even be prescribed to us. I say that with tongue in cheek because we obviously have to do our research, and we obviously have to seek maybe a second or even a third opinion. But at the end of the day, we are the captain of our own ship, and we have to make sure that we are, this is a theme that's running through here, that we are being heard and that we are speaking up, because you can't be heard if you don't speak up. So making sure that we take our health into our own hands in the form of being our own advocate. I love when Kimberly talked about the fact that caregiver is not just, because I'm a caregiver as well. I'm a caregiver for my son who has special needs, but I'm also a caregiver for myself. I love how she says, you're a caregiver for yourself. You are your first caregiver, so you have to make sure that you are getting the care that you deserve. So, it's absolutely wonderful. So before we go to break, which we're about to do now, before we go to break, I want to let you all know that after the second half, we're going to come back with some more speakers. And then after that half, we are going to have a Q&A. So start jotting down your questions. If you haven't already, start jotting down your questions. So that way, when we get to our Q&A segment, you are locked and loaded and ready to go, because I'm telling you, you want to make sure to get your questions answered, even whether it's something of your own or if it's something about the speech itself, but you want to make sure to get those questions answered. So, all right, you all. So we're going to go on a quick 5-minute break so you can refresh your water, your tea, your coffee, potty break, whatever that may be. And we will see you guys back in 5 minutes.
Michele,
All right, all right. Hopefully everyone has made their way back into the Zoom room. And again, if you do have some family and friends and colleagues, make sure to have them come into the Zoom room where the heat is. Because when we get finished with this second half, we are going to start our Q&A, and only those of you who are in the Zoom room will be able to participate. So you definitely want to make sure that you are in the Zoom room. All right, so we will go ahead and get started with our second half. Well, are you guys ready? Are you ready for the second half? Let's get some love in the chat. Put something, I see the head nodding. Let's put some love in the chat. Put a 4 in the chat if you're ready to get started. Before we get started, I want to see some 4s in the chat. So put some 4s in the chat, or you put a heart in the chat. You can use some emojis. Okay, I like that. Let's go 444. Or I guess I should say make so it rhymes. Let's go 444. Absolutely wonderful. Yes. Oh, I'm seeing the love in the hearts. Absolutely, you all. This has been absolutely phenomenal. And so if you are receiving the same amount of value that we're receiving today in this room, you want to make your way from Facebook and come on inside to the Zoom room. So I do have the link there. You may have to scroll all the way up because there's been so many comments on Facebook. We'll scroll up and then you can see the link to get in. And just so you know, if you wanted to go ahead and get in, then just go to bit.ly, so that's bit.ly/ and the rest of this is all caps, WHAS 2024. So that's bit.ly/ WHAS 2024. That is the link that you guys can go on and get into the Zoom room so you can get your questions answered for the next half. And of course, so you can be here right up close and personal. All right, so without further ado, let's go ahead and get the second part started. I have the pleasure and privilege of introducing to you all someone who I had the opportunity to meet at a virtual coffee. And this young lady, there's just so much wealth of information that she is about to bestow upon you all. And it is definitely something near and dear to me because of the time frame that she experienced some of her challenges. And I had some challenges as well during that time period. So I don't want to give it away, but I just want to let you all know that perk your ears up. If you're still out getting that coffee, let me talk a little louder. Come on back into the Zoom room. You want to come see this. All right, you all. So without further ado, I want to tell you all about this young lady. Her name is Jennifer Perry, and she is a transformational life and empowerment coach, best-selling author, and speaker with over 2 decades of experience empowering women. Her mission is to help women live financially fearless, embrace their inner worth, and become the sheroes of their stories. Featured as a thought leader, Jennifer has appeared on ABC, NBC, Fox, CBS, Vanity Fair, Southern Woman, Fortune, and Forbes. She was recently named one of the most influential women to watch in 2024 by Victory Magazine. So you all give me a warm virtual round of applause as we bring this victorious woman to the stage, Jennifer Perry. Come on down.
Hi, everybody. Thank you so much for such a wonderful introduction. I'm very happy to be here. I feel very blessed to be here with all these incredible speakers and stories. And I'm going to get my slides up and you'll just have to let me know if you can see them. Hold on one second. If they decide to cooperate with me today. Okay, can you see them? Yes, fabulous. So again, thank you so much for an incredible introduction. And I wanted to come on today just to share a little bit of my story. And I will be 53 next week. And out of the 53 years that I have been alive, there is a period of 56 days that completely changed my life. And I want to just give you a little bit of my storyline of what was happening in my life at this time. I am married to the love of my life. We've been together for 9 years. I have great children. I have an amazing family. I have 5 beautiful grandchildren. In my spare time, I am a documentary filmmaker because I believe that storytelling is powerful and that our survival stories become somebody else's, guides in their own lives. And these are my 2 precious little pups. And I had just celebrated my 50th birthday with an amazing group of friends. And I can tell you my coaching and consulting practice was at the height of its time ever, helping women all across the world. And everything was going perfect in my life. And we have a tendency sometimes to get sidetracked when things are perfect in our lives and not know that unexpected things will come. And that's what happened to me. We were 5 days before Christmas. My husband, who is Italian, was thinking of everything under the sun he could make for everyone. And we were getting ready to have a bunch of friends over. And I woke up and I couldn't feel my feet. And as the day progressed, it got worse. And here I was, December 20th, by myself, heading over to the emergency room. And after a ton of tests, I was diagnosed with Guillain-Barré syndrome and never heard it, didn't know what it was, never experienced it. But the best way to explain it is it's like turning off a light switch and disconnecting the connection between your brain and your nervous system. And can you hear me?
Yes, we can hear you.
Okay, I just got a thing up that said somebody requested to unmute me. Sorry. Okay, perfect. So over the next 5 days, I slowly but surely started to become paralyzed. And this was when I was in the emergency room, just diagnosed, live in a small mountain community outside of Atlanta. And I thought, how in the world can something that sounded so foreign be diagnosed in a small mountain community? So I was put into intensive care and I was sent over to Emory University in Atlanta. And over the next 5 days, slowly went completely paralyzed from my shoulders to the tips of my toes. And I found myself, even part of my face, having Bell's palsy. Everything in my life completely stopped. And it changed everything. The impact that it had in my life, the impact it had in my business, in my family. And here I was just the day before feeling normal, getting ready for Christmas. Everything was wonderful. And then I found myself essentially fighting for my life. After a 5-day infusion, just as it was getting ready to start paralyzing my lungs, and I was going to end up on a ventilator, the infusion that I had, IVIG, started to turn things around slightly, and I could start moving my hands and my fingers, but I didn't feel anything. I still couldn't feel anything. And it was definitely the scariest part of my life. I'd been through a lot, as we all have, but when you have something that comes on so fast and you don't know what it's going to mean for the rest of your life, it completely changes everything. And I went through this roller coaster of emotions, and I was angry because I felt like my body was betraying me. I was angry because even a lot of the doctors that I had surrounded myself with didn't know what caused it, didn't know the best treatment for it, because there's little known other than data points. And I was confused as to how did this happen to me? And then sadness and grief hit. I couldn't believe what I was experiencing. I started to mourn what was going wrong with me because I didn't know what was going to happen. I had heard people were still in wheelchairs 30 years later. There are people who had lost their life. There are people that were never the same. And I thought, oh my gosh, what's going to happen now in the future? My husband, is he going to leave me? Are my clients going to not want to work with me? What is it going to mean for me? Am I ever going to get my legs back? Am I ever going to have a normal life again? And even though I was surrounded by such an incredible group of people and support system, I still felt completely isolated and alone. And I felt like I was sitting there and I was watching everybody live a life around me. I had leg envy. I had walk envy. I was watching people do things around that I just couldn't do. And I never knew if I would be able to do them again. But then there was something as the days went on, and I became to educate myself. And I'm also a master mindset coach. I looked at myself and I looked at my life and I said, you know what? I need to invite people into my journey because I want them to know that no matter what they're going through, let's go through this together. Let me allow you into my ugly to let you know that we can transform our lives. It starts right up here. And it starts by taking control over your mindset. So once I started to accept it and I started in the healing, I definitely had hope and tremendous renewal in what it was that I was experiencing, because I surrounded myself with so many people who had opened up their lives to me to help me. And at the same time, I was able to coach them. The doctors and the nurses and all the people who were around teaching me how to walk or trying to help me walk. It was very inspiring that I was there for them as well. I could listen. I might not be able to move anything, but I could certainly listen. And I started getting a bunch of text messages and gifts and things that were being sent to me. And on 3 different occasions, I received something that had this verse on it, that you were assigned these mountains to show others that they could be moved. And I felt, you know what, we got this, and I'm going to do it. And I put my life fully on display. And I brought everybody along with me in social media. I let my clients all know what was going on. And I figured together we were going to get through it. So here I was at 50 years old. I came home 30 days after being in the hospital. I was in a wheelchair. I did regain use of my hands, but I didn't feel them. So I, at 50 years old, had to learn how to walk again, and how to use my hands, and how to drive, and how to brush my teeth, comb my hair. I had to relearn all the things that I took for granted, that we all take for granted. And I was very determined. And I spent a lot of time every day focusing on it. On the days where most of us try to get 10,000 steps a day, I was happy to get 100. And I did that, and I continue to do that. And I went from a wheelchair to a walker to a cane, back to driving and having a somewhat normal life. And there were lessons that I learned along the way that I just want to share with you, no matter what it is that you're facing. And for all the people who've already shared, I learned that being vulnerable is really okay. It's one of the strongest things that we can do, allowing us to rely on other people and allowing other people to be there for us. And I learned to find gratitude in a lot of the grief that I was going through. I became very, very grateful for even the smallest things. And that is something that I continue to do every day. I start my day with gratitude and I end my day with gratitude. And I learned to lean on my faith and my circle. We had just moved into this mountain community. And I thought, here we are, the new people on the mountain, and the people that came out and my community supported me and was here sitting with me, offering to clean the house, offering to bring food. And I allowed people to step into their love languages to be there to support me. And it was just a beautiful thing. And finding opportunities in the obstacles, no matter what it is you're facing, there are blessings along the way. And you have to just be open enough to receive them as you're going through, no matter what it is. And really, your tests in life become your testimony, and your trials become your triumphs. And the only limit that we have is ours. And I remember the doctor standing at the end of my bed saying to me, you are not going to walk for at least a year. There is no way. And 56 days into my recovery, I took my first steps. I wasn't going to allow somebody else to impose what they thought I was capable of doing on me. And I don't want you to ever do the same. And no, I don't know what's going to happen for me. I don't know what the future holds. I can tell you, I'm about 75% back to normal. I may never get all my feeling back in my hands or my feet. I still wear AFO braces on my legs. They're still healing. But I do know that the next chapter of my life is going to be fine because I trust the author, and that's me. So I want to just thank you for letting me come on just to try to inject some inspiration in your life today with my story. If you'd like to reach out to me, you can find me on my website. I have a ton of information. I actually have my whole story on there that was just featured on Amazon Prime. It tells you about my story. You can reach out to me on Instagram and Facebook. I'm very active on both. You can send me an email, jennifer@shirocoaching.com. I have a brand new podcast called The Shiro Effect, and I am releasing my 4th book this next week with Lisa Nichols. And if you just want to email me, let me know that you found inspiration in this. I will send you a copy of that as soon as it comes out. So thank you again for allowing me to come on here and share this little bit of inspiration with you.
absolutely wonderful. I hear the crowd going wild. Do you all hear the crowd going wild? When I told you all about somebody who was coming up who is victorious, I was not playing. I was absolutely serious. And one of the things that really stood out to me, amongst many, and I took down each and every one of her lessons, because again, when someone else gives you a lesson, that is a blessing, especially if you hadn't had to go through it yourself. So now you get to learn without having to go through the pain and angst of the obstacles that they were presented with. And what I wrote down was that, you know, when she talked about how the doctors told her that it would take a whole year. And I thought to myself, you know what? Other people's opinions of us is not our business. You know, their limitations are not our limitations. And we do understand that they can only tell us what they see. And I had a similar experience to that in my own life. So I definitely appreciate you being able to shine a light on that, you know, just as well as also having that gratitude, waking up and ending with gratitude. That is something, gratitude, the attitude of gratitude, it will help to elevate your latitude. So definitely having that is something that you want to hold near and dear. So thank you so much for also letting us into your life, for casting out what has happened to you, so that way you can be a blessing for others. So we appreciate you sharing that with our audience at large, and then here with us on our second annual Women's Health Awareness Symposium, Our Mind, Body, and Soul. Thank you again, Jennifer. All right, I want to introduce the next person to the stage. This gentleman, I was introduced to from a friend. I know y'all like, man, you have a lot of friends. Yes, I do, because your network, it determines your net worth, right? So, so I want to bring someone to the stage who was absolutely amazing. And actually, you know what? Can you not share just yet? We can see your screen. I'm still introducing you. All right, cool beans. So yeah, listen, no freebies. You all have to wait to see this goodness of information, right? No sneak peeks. All right, so this gentleman I want to bring to the stage. His name is Dr. John Lipman, and he is a board-certified interventional radiologist and renowned authority in the non-surgical treatment of uterine fibroids. He is also a philanthropist, entrepreneur, and award-winning public speaker. He received his master's and medical degrees from Georgetown. He completed a residency at Harvard Medical School and then did a fellowship in vascular and interventional radiology at Yale. He currently serves on the editorial advisory board of ShareCare, an interactive internet healthcare platform founded by Dr. Mehmet Oz and Jeff Arnold, the creator of WebMD. He was an Atlanta Business Chronicle's Healthcare Hero of the Year, which he still is, right? And a top doc in Atlanta from Atlanta Magazine, and a trailblazer physician of the year from the Atlanta Medical Association. Dr. Lipman is the founder and medical director of the Atlanta Fibroid Center, a state-of-the-art medical facility that specializes in non-surgical treatment of uterine fibroids and has cared for women from throughout the world. I want to introduce to you all, give a resounding virtual applause to Dr. John Lipman. Take it away, Dr. John.
Well, thanks so much, Dr. Michele, for inviting me to speak on a topic that's very near and dear to my heart. I really enjoyed Anthony's talk on estrogen because that is really important in our trying to understand about fibroids. Unfortunately, we don't know where they come from, but once they arrive, they grow with estrogen. And that's why they can grow rapidly during pregnancy, and why for most people, it's not an issue when they're in menopause. However, I'm going to talk about, well, what happens when the car is broken? And I'm going to talk about how women can avoid hysterectomy when they're suffering with uterine fibroids, because every day in this country, unfortunately, 3,000 women lose their uterus, most commonly due to fibroids. We have the highest hysterectomy rate in the world, and the southeastern United States leads the hysterectomy rate. It's the second most common surgery done in the United States, which is staggering because half the population doesn't even have a uterus. 1 in 4 women by age 40 and 1 in every 3 women by age 60 has already undergone hysterectomy. And this is much higher. There are much higher rates in African-American women. The average age of hysterectomy is under 40. And I've met way too many women under 30. that have already had hysterectomy. None of them wanted it, but they were suffering so bad and they were not given any other options. And I'm here to tell you about this amazing option in just a moment that replaces hysterectomy completely. Again, the most common reason why we do this hysterectomy procedure is due to benign fibroids. We got to stop that. Here's a study out of Michele showing in the solid lines African-American women and the dotted lines Caucasian women. And you can see how much more surgery is done on women of color for fibroids than Caucasian women. And you can see the age down here. It starts in the early 20s and peaks just under 40. And I'm here to tell you, no matter what your gynecologist tells you, you do not need hysterectomy for benign disease. And I hear that every day in my office. My gynecologist told me, if I'm done having children or I'm not interested in children, I don't need my uterus. That's absurd. The uterus is not the appendix. When women lose their uterus, it can affect them psychologically, like a man being castrated. It can affect them sexually, loss of libido, loss of orgasm. And these things are real, but people don't want to talk about it. It's embarrassing. We heard earlier talks from Anthony about bone health. Losing your uterus impacts your bone health. It impacts your urinary health. And if you don't believe me, go to Publix, Kroger, Walgreens, wherever they sell adult diapers. Who you should see on the package is an elderly man or woman. You won't. You'll see a young, attractive woman of color. Why? Because that's the target. Those are the people that need adult diapers. Young Black women, not old people. It's crazy. And we also heard from Anthony that estrogen is important in heart health, and losing your uterus impacts your cardiovascular health. There was a study done by the Mayo Clinic and the chief of OBGYN about 10 years or so ago. They looked at roughly 1,000 women with fibroids, and they were startled to find out that the average time to treatment for these women suffering with fibroids was over 3.5 years, and a quarter of them waited over 5 years, and they were perplexed. Well, the reason was, when they asked them, they didn't want surgery. They didn't want hysterectomy, and I don't blame them. And over 3/4 of them weren't given any other option. They weren't given the option of UFE, uterine fibroid embolization, the non-surgical choice that I'll talk about in just a second. And the power to choose obviously is meaningless if you're only hearing the surgical options. Women are entitled to know all the options. Well, how do you know if you have fibroids? Well, it's the most common reason why women have heavy bleeding. And sometimes women bleed so heavy for so long, they don't realize that it's abnormal. Just because you've been doing it a long time doesn't make it normal. And oftentimes these women have chronic iron deficiency, which makes them weak and tired. They might be lightheaded or dizzy. Chewing and craving ice is a big one. Migraine-like headaches. Blood can literally gush out of these women. It's scary, crime scene-like periods, bleeding through clothes and linens, despite multiple different types of protection, even diapers. Sometimes, as I mentioned, they don't understand what's heavy. Well, if you're changing 8 or more pads in a day, or less than every 3 hours, or if you're having any of these symptoms, obviously that's not normal. These tumors are hard and firm. They're like rocks. And so they can not only cause heavy bleeding, but also push on things and cause bulk-related symptoms, whether it's abdominal or pelvic pain, pressure, bloating, painful intercourse for those fibroids near the cervix, ones in the front of the uterus near the bladder, cause increased urinary frequency. Patients will wake up multiple times a night, and it can be mistaken for a urinary tract infection. It's not. It's due to these fibroids compressing the bladder like a paperweight. Well, what is this UFE procedure? It's a tremendous option for women. It's been around for over 25 years. But unfortunately, the gatekeepers of women's health, the gynecologists, they're surgeons, they want to operate. And so they don't mention this great option. It's outpatient, it's non-surgical. It's about a 30-minute procedure. And the patients go home with a Band-Aid. That's it, a Band-Aid. The uterine arteries are like big trunks. There's a uterine artery on each side of the uterus, and they branch like a tree. And so I can negotiate a tiny little catheter, like a piece of spaghetti, into each of the uterine arteries one at a time. and I can flow direct these particles to block the blood flow to each and every fibroid, no matter how many they have, no matter how big they are. The big trunk and the main branches of the uterus stay open, so the uterus is alive, but all the fibroids are dead. And as they die, they soften and shrink, and a woman's symptoms disappear. So if you look at the difference between hysterectomy and UFE, it's staggering. Hysterectomy is done in the hospital, general anesthesia. It's a major surgical procedure. Sometimes they have to cut women vertically from their breastbone, vertically all the way down to the pubic hairline. Big surgery. And it's usually done open, even though you'll hear about robotic and laparoscopic. Usually their uteruses are too big and you just can't accommodate a laparoscopic procedure, but it's still surgery. Yes, you recover a little quicker, but look at the comparison to, look at the comparison to UFE. UFE, it's outpatient. It's not done in the hospital. We do it at our own center. There's no general anesthesia. You go home with a Band-Aid. You have a brief recovery, 4 or 5 days versus 6 to 8 weeks typically. And importantly, and often underappreciated even by physicians, you get to keep your uterus and even have children after. Here's a actual procedure being performed. You can see this little tiny catheter in the right uterine artery, and we're taking a picture to get a roadmap, and you can kind of see the blood vessels of each of these fibroids, and the vessels are at the perimeter of each of them. And then we embolize the fibroids, knock out the blood flow, and you can see the blood flow is staying in the uterine artery, but you don't see any of the fibroid vessels. And just to show that schematically, you can see this catheter delivering particles to the fibroid and not to the rest of the uterus. And again, our approach is at the top of the right leg. Some centers will do the left wrist, but this is a much easier, safer approach from the top of the right leg. It's also much closer to the target. We use MRI imaging. A lot of patients have had ultrasound, but the MRI is like high definition television, much better than ultrasound. This is a side view of the woman's pelvis. You can see the front of her here. Here's her bladder, pubic bone, cervix, and you can see this big fibroid that's stretching the lining, and she was having horrific periods. 6 months later, you can barely see the fibroid. All of her symptoms are gone. Again, here's a big fibroid bulging her out like a pregnant woman. These women often look pregnant, and no one wants to look pregnant when they're not. And you can see 6 months later, barely can see these fibroids. So the patients will stay at our center for several hours and go home. Recovery, as I mentioned, is about 5 days typically. You get a Band-Aid, no surgical wound or incision, and all insurances cover this. The results are outstanding. Over 90% of patients get significant or complete resolution of their symptoms, whether it's bleeding, whether it's pain or bulk, or both. It has no size limit, no number limit, and the recurrence have to treat somebody more than once is really unusual. So in conclusion, let's stop the unnecessary amputation of young women, particularly young women of color. We don't need to do this anymore. If you suffer with fibroids, consider UFE, get a second opinion from an interventional radiologist that does these procedures. You get excellent results with significant reduction in symptoms. UFE is safer, it's less invasive, it's less expensive, shorter recovery, and importantly, you get to keep all your parts. I appreciate you listening to this, and if you want to reach out to me or learn more about this, you can hear some of the ways you can reach me. Our website is atlii.com. There's lots of information about this. Here's my IG page, dr_ my last name. If you want to actually watch me do a UFE procedure, you can go on YouTube at Atlanta Fibroid Center. And for those that want a free e-guide on how do you avoid hysterectomy for fibroids, you can go on our website /guide and get your free How to Avoid Hysterectomy e-guide. Thank you.
I just wanted to pause for a moment. I wanted you guys to have the opportunity to take in everything that you just heard. Each and every slide was like a OMG, OMG, OMG. Seriously? Really? wow. And I'm seeing it, I know I'm seeing it in the comments popping up. Everyone in the chat has been blowing it up, and also being vulnerable in the chat and letting us know that they are experiencing some of these symptoms. What Dr. Littman just shared is life altering. We do not have to have a hysterectomy for benign tumors. So when you talk about the fibroids, you don't have to have a hysterectomy for that. I just wanted to kind of just sit with that. Leaving with a Band-Aid with 4 to 5 days of recovery, as opposed to a very invasive surgery with 6 to 8 weeks recovery. And you don't get to keep your own parts. So please put something in the chat. Matter of fact, I don't even ask. I'm seeing it lighting up here on the side here. Yes, I'm absolutely phenomenal. I'm seeing all these comments in the chat. There is still time if you want to be a part of this Q&A. We have one more speaker, and then we're going to take a break, and then we're going to start the Q&A. Get your questions ready. If you are on Facebook, we're glad you're able to see this, but guess what? You can't ask a question on Facebook, but you can if you come into the Zoom room. So we have bit.ly/WHAS 2024, and the WHAS is all caps, 2024. So make sure that you make it into the room, and make sure you take this opportunity right now to share this out with someone so that they can see this. This is life-changing information. Life-changing. I know so many women, so many African-American women who have gotten hysterectomies unnecessarily based on what we're hearing right now. When we've been told repeatedly that that is the only option, and it is not. And particularly during childbearing age. Did you all see the graph? This isn't something that you can put back once it's gone. So please share this out with somebody else. Contact Dr. Littman. If you have any questions, please make it into the Zoom room. All right, you all. I just definitely wanted to just really lean into that, because this is absolutely amazing. And yes, the graph was visually astounding. Absolutely, Dr. Shalina. Absolutely, it was astounding. So, all right, without further ado, because I think it is due for us to have some moments where we can kind of recover. And when I say recover, is because the information, it was just absolutely staggering, but it was necessary. And so now I want to make sure we turn the corner with our last speaker here. And we're going to talk about the importance of spiritual growth. We're going to tie this all together, because the name of our symposium, our second annual Women's Health Awareness Symposium, is Mind, Body, and Soul. So we're going to wrap up our presentation part segments with someone who was going to cover the spiritual growth. This person is near and dear to me, Reverend Dr. J.D. White Sr. is very near and dear to me, because he happens to also be my pastor, my shepherd. So without further ado, you all, let me read to you all, let me share with you all who this wonderful man of God is. Reverend Dr. J.D. White Sr., having a strong, spirit-filled family, confessed a hope of Christ at a very young age, and accepted his call into the ministry at the tender age of 14. A few short years later, he became an ordained minister. Pastor White is a published author, third vice moderator for the Fellowship District, and has preached in some of the most distinguished churches across America. His applicable style of preaching will educate the philosopher, yet spoon feed the child. In 2018, Pastor J.D. White was unanimously voted to be pastor of Greater Olivet Missionary Baptist Church in Detroit, which broke the church's history of becoming their youngest pastor at the age of 32. Greater Olivet experienced tremendous accomplishments within his 6-year administration, and despite conditions amidst a global pandemic. In September 2022, Pastor White was blessed to receive his doctorate of theology degree from the Well Center of Theological Studies. With 20 plus years of ministry, he has gained national respect from spiritual and political leaders around the globe. Without further ado, I want to introduce to some and present to other who is near and dear to my heart, my shepherd, the man of God, Reverend Dr. J.D. White Sr. Come to the stage, sir. Oh, we can't hear you.
Good afternoon. Okay, I'm there now. Good afternoon to each and every one of you. Certainly, it is a privilege and pleasure to be here with all of you. Dr. Michele, of course, near and dear to me. We bless God for you. Thank God for you. And every presenter, really, this has been very, very, very informative, some great life-changing information. And so we really need to make sure that we do a better job, or an even better job next year, making sure that we level up. And so we want to commit to that for sure. So this has really been a very life-changing experience. So we'll just jump right into it. So again, my responsibility today is kind of relatively simple for me, but for us to talk about the importance of spiritual growth. I saw a startling statistic. According to a census done in last year, so 2023, and I'm reading it here, it says that approximately 280 million people in the world have depression. That's a startling statistic. And I even heard in many of the presentations about how you have to advocate for yourself, because that's kind of, now we kind of dependent upon, what you're battling with. Sometimes you go into particular facilities and that's kind of the first thing that they throw out. Oh, it's just this. It's so here's, take this medicine, whatever the case may be. And then they just kind of send you on your way. And so the same way that you have to advocate for yourself from a physical perspective, you also have to ensure that you're advocating for yourself from a spiritual perspective, right? Because what we know for sure, if there is one common theme that we have from the beginning presenter up until now, and that's that in life, you're going to have some ups and downs. In life, your body can change. In life, things can be okay on Monday, and then something shifts on Tuesday. Lady Willis again gave us a great presentation just talking about how things were okay, and then out of the blue, just out of nowhere with no sort of history, it became this, it became that. And so we understand really from all of the presenters that the common theme in all of this is that life is unpredictable. And so that is really when it is during those times where it implores for us to ensure that we have that degree of a spiritual compass, if you will. Okay. And so I want to read this to you again. I have a few notes here, but it says, why, right? Why is spiritual growth important? So spiritual growth enhances our ability to deal with life's ups and downs and bounce back from those difficult experiences, right? And so by us having a degree of spiritual importance or a degree of spiritual maturity, we have a challenge, or we have an answer, right, that we must, or a question that we must ask ourselves. And that is, right, is the glass half full? Is the glass half empty? Me personally, I am, again, one of those half full kind of guys, because I believe that we can allow ourselves to recover from anything, right? And so it becomes the thing that your mind and how you deal with things is extremely important, right? So how you talk is going to be extremely important. It's going to be extremely important with your environment, how you have people around you. At our church, we have a saying, right? I say I'm a God man. The men say I'm a God man. The women say I'm a God woman, because affirmation is extremely important. One scripture in the Bible talks about how David had to encourage himself in the Lord. And so what you find is that many times, right, when we're dealing with various things, knowing how to encourage yourself is going to be huge, right? It's going to be very important with how you deal with the next step. Okay. So, again, as we deal with these various things, right, you go into these situations and you might go in feeling one way, not necessarily knowing how or how you're going to be feeling or what the report is going to be once you leave these doctor's offices, or as you just deal with anything, right? As you deal with anything in life, the question that you have to answer is, okay, how are you going to respond? I'm a huge basketball fan, and we're in the middle of the NBA playoffs, and there's a team called the Minnesota Timberwolves who's playing, and they have a superstar, or a great player. His name is Anthony Edwards. And he, after a game that they had won, he talked about in the interview how he was talking to his coach. And his coach was saying, hey, we got to be prepared for the other team. They're playing the Denver Nuggets. We have to be prepared for them to hit us back. And Anthony Edwards said, yeah, coach, that's fine. They're going to hit us, but we're going to hit back as well. Okay. And so that is the dynamic of, again, what our spiritual growth allows for us to do. That when life hits us, our spiritual growth allows for us to hit back. Okay. And so that, again, is extremely important. We want to look at, all right, hey, life hits, how are we hitting back? And so there are about 5 things I want to give us. And Dr. Michele, if you don't mind, or if anyone really, if you guys can just put it in the chat. Again, forgive me for not having the time to do the slides and things, so I apologize for that. But 5 things that I want to leave us, and here's again 5 benefits to developing, right, our spiritual nature. 1, right, here's the first one: hopefulness. 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 Okay. Listen, the last thing that we want to do is encounter anything that you're going to go through in life, right? Whether it is a major loss, whether it is a major change in what's taking place medically. I know that sometimes, right, I have gone, me as a Black man, I've gone into my primary care physician. It's been a while, but I've gone into my primary care physician office, and I felt worse leaving there emotionally than I did physically, simply because I did not feel like they were listening to me, right? I felt like they were passively treating me or dismissing how I felt, and that really bothered me from an emotional perspective. Okay. And so, again, going back to what it is we talked about earlier with having to advocate for yourself, right? It's like, no, there are other ways and things that take place whereby we require a degree of hope. Okay. And so hopefulness is huge, okay, when it comes to our degree of spiritual maturity. Hopefulness is absolutely important, okay, with how you fight back. Hopefulness is important when it comes to how you fight back. You don't just have to take the hit. You don't just have to lie down. You don't just have to lie down and die. Fight back. And the way that we do that is by way of never losing our hope. The more hopeful we are, the more tenacity we have in being able to advocate for ourselves. Sometimes it becomes difficult for us to advocate for ourselves because we literally don't have any hope. So we just take whatever it is. We just take whatever's coming at us. We just take whatever the diagnosis is. We just take whatever is going on, and we're just like, hey, I guess this is it. The doctor said this, and I guess it just has to stay this way. Or this is going on, and I guess it just has to be this way. Okay. But hopefulness, again, allows for us to fight back. The second thing that spiritual maturity allows us to have is compassion and understanding. Okay. Compassion and understanding. It becomes very easy to look at others with judgment and criticism and all of those things. But when we start to grow spiritually, we realize how much healthier it is to cultivate compassion and understanding for others instead. Compassion and understanding is huge, right? Letting it go, getting all of those things out of your system, getting all of those things out of your attitude, getting all of those things out of your life that do not mean you any good. When you have the degree of compassion and understanding, it allows for you to also understand that whomever you're dealing with, they may not be in the best place in their life. Right? So they may be mishandling you because they're not in the best place. It doesn't have to be, right? They just simply may not know how to handle you. And that's fine. They may need to mature. And that's fine, right? They may need to grow. And all of that is fine. But as we, again, are dealing with our own spiritual maturity, ensuring that there is compassion and understanding is extremely vital. Right? So many times we hold on to all of these negative emotions simply because another person has done us wrong right? But by the same time, they've done us wrong because they're not mature enough to handle us properly. Okay, I tell our church that all of our lives, if you think back, I know nowadays everything's digital, right? We got Apple Music and iTunes and all of those sorts of things. But years ago, right, we had a CD, okay, and an artist would come out with a single, and they would put it on a CD, and on these CDs, right, it would be 9, 10, 11 tracks, okay, and on the CD, some were good songs, some were bad songs, some songs were great, right? But you bought this entire CD, and it was an array. And for many of us, what we have to realize is that our lives, okay, are just like that CD, right? And we go through seasons where some of our seasons with other people are great, right? There are some people who purchased our CD or come into our life, and they've had mediocre experiences with us. And then there are some people that we've come into contact with, and those experiences were horrible, okay? But we all have that, right? I have my own life CD, you have your own life CD, and depending upon the seasons that people interact with us, will determine what version of us they get of us, okay? And so compassion and understanding is absolutely vital. It is absolutely vital. Here's the third thing. The third thing is a sense of purpose and meaning. A sense of purpose and meaning. You are here in whatever capacity of here is, okay? But you are here because you're supposed to be here. And it is important that every day you tell yourself, I'm here today because I am supposed to be here. I still have purpose. I still have meaning. It does not matter what the circumstances are. It does not matter. I believe 2 presenters ago, the young lady was talking about how she was dealing with her Guillain-Barré syndrome, and how she came across the quote that ultimately alludes to this same thing, that you're going through this so that you can help and encourage someone else, okay? And sometimes, right, sometimes that's just our journey. That's just our story, okay? And so it is meant, all of us has this sense of a purpose. All of us, we're here for a reason. And it is vitally important that you remind yourself of that. I tell, again, sometimes in preaching presentation, I talk about the dynamics where it comes to a storm. And when it comes to a storm in life, you have 3 different phases. Some of us have just come out, some of us are in, some of us are going into. And so all of us have a role, okay? And so when it comes to the dynamic of, again, storm, if you've come out the storm, right, it's vitally important for you to encourage those who are in the storm to let them know that there's a brighter day. And if you're in the storm, those who are coming in too, it's important that you let them know that they can survive, okay? All of us have a purpose. And it is important that every day you tell yourself, I'm still here for a reason. That's why you're a survivor. You're a survivor. You haven't survived whatever it is you survived, whether it be, again, breast cancer, whether it be some sort of other form of major medical condition, or whether it's depression, or just whatever it is you survived. You have not survived it for you to keep the story to yourself. That's why these symposiums are so vitally important. That's why we have to tell the world, hey, come and check out, because people need to know that whatever it is they're going through, they can survive, right? The Bible says it this way, that we overcome by the word of the testimony. That's all this is. It is all of these speakers sharing their journey and talking about how they have survived. And because they have survived, now they have a story that they are trying to share to the masses and let people know, hey, this is how you can get better. This is what you can do. This is what you can do differently, right? The previous presenter, he was absolutely marvelous. And he's letting people know, listen, you don't have to do this. These are your options. Don't settle for this, right? Because us surviving is information, okay? And it is in us sharing that information, okay, to other people that gives them the strength and encouragement that they need. All right, so that's number 3, sense of purpose and meaning. Here's the 4th one: inspiration and appreciation. Okay, inspiration and appreciation. Do you understand that you are the light of someone's life? You are the light of someone's life. There is someone that you are connected to, whether you realize it or not, that they are looking for they are looking for your positive attitude. They are looking for your smile. They are looking for your bubbly personality. You are the light of someone's life because all of us are looking for inspiration from somewhere, right? And so in our spiritual growth journey, right, we all should endeavor to be used from the perspective of trying to inspire others and let them know, right? You are the light of someone else's life. That when they are having a bad day, they're looking to talk to you. And they're not looking to talk to you, right? They're not looking for you to recite scriptures from Genesis to Revelation, but they know they can count on you to make them laugh. They know they can count on you. And in that 5-minute experience, the troubles of their life, just simply cease because you're a person that's going to ask them how they're doing. You're a person that's going to remember their children are graduating. And so you're going to say, hey, how's your son? How's your daughter? How they doing in school? Right? You are the light of someone else's life. And so it becomes our responsibility to not only be light, but to also find light. So that way, when our light dimmers, we are connected to people who can reignite our lights. Right? And then we can't be selfish with the light. We then got to take the light and we got to share the light with everybody. Right? We got to share the light with everybody. And so it is vitally important, again, that we be light, but at the same time, that we find those who are light for us. Okay? So that's inspiration, but then also the dynamic of appreciation. Everybody, I want you to do me a favor, put this in the chat, right? Put this in the chat. Learn how to appreciate yourself. Learn how to appreciate yourself. There is so much to be grateful for. There is so much, listen, you've done a great job. Right. And again, it becomes so vitally important that's what you've done a great job. You've done a great job. You're doing a great job. And whatever it is, you've done a great job. And so it becomes so vitally important that you learn don't ever stop appreciating yourself. I don't care what title they give it. They can call it arrogance. They can say you stuck up. They can call whatever it is they want to call it. Okay, but you better learn how to appreciate you so that way you can learn how to make your own self feel good. So that way you can make your own self develop the desire to live. So that way you can do these things for yourself. So that way you can be a beacon of hope for someone else. Okay, so again, that's inspiration and appreciation. Here is the last one: peace of mind. Peace of mind, right? Part of spirituality is connecting to a higher power, whatever name or label you want to give your spiritual source. For me, I know what I believe, but for me, that isn't that. I'm saying whatever your higher power is. The important thing is that at the end of the day, you understand and that you are connected, you are connected to a higher power that allows for you to know and believe that all is well. And that has to give you a peace of mind. That has to give you this degree of peace of mind in knowing, like, hey, you know what? God got it. God's got it. It might be too broad for my shoulders, but he got it. It might be too much for my hands, but he got it. And you must allow that peace of mind to overwhelm you, to overtake you, so that way your life can be settled. You can walk in peace, you can be in peace, and you can know that because I'm here for a reason, there must be something greater, bigger, and better that God is going to do. Okay? All right, and so that's all that I have for you all today. Thank you all so much again for this time. Dr. Michele, as always, you know that I love you. Thank you so very much for extending this invitation. Again, I've enjoyed every presentation, and I look forward to, again, just for more that comes from this. God bless each and every one of you. And at this time, Dr. Michele, I'll turn it back over to you.
Thank you so much, Pastor White. OMG, that was absolutely phenomenal. I could not write fast enough. I could not type fast enough. And FYI, slides were not mandatory. They are just an aid. And I'm telling you, it was definitely not needed or necessary in this presentation that you just lit the stage on fire. I could just recap so much, but y'all, the hopefulness, compassion, understanding, sense of purpose and meaning. I wrote in capital letters, I am here today because I am meant to be here. Each and every one of you all are meant to be here, not just here in this symposium. Although, yes, you are meant to be here, you wouldn't be, but you're also meant to be here on this earth. You have a purpose. You have an assignment. And it is your assignment to figure out what your purpose is. So that way you can help others. You can be that light to others that our Reverend Dr. J.D. White talked about. Be the light, share the light, find the light. If you don't have the light and you aren't the light, go find the light. So that way you can be in the light and then you can harness it and share it with others. Because a phrase came to my mind, and that is Jim Rohn's, "The same wind blows on us all." We all have our own proverbial cross to bear. We all have had ups and downs. If you look at the graph that Dr. Lippman put in there, it's like we all have our ups and downs, right? We all are going to go through something in our life, but don't stop. Keep going. Go through it. That's why it's called going through. So go through to the other side and then reach back and help somebody else. That's why we go through those things. You know, I loved it when Jennifer Perry talked about the fact that, you have to have a test
Yes.
in order to have a testimony. So
You don't have a bigger version of this 5-in-1.
oh, somebody is off mute. Can you please mute yourself? We're hearing your conversation. I'm just going to say that person must have gotten really excited and hit the off mute button. But listen, you all, absolutely phenomenal information. And we are going to go to a break right now. And when we come back, it's going to be our Q&A segment. So make sure you refreshing your water, take a potty break, coffee, whatever you need to do, get your pen and paper ready. And listen, you all, I have pages of notes. So make sure that you have your questions ready, because we are going to come back with our next segment in 5 minutes, our Q&A. So if you haven't made it to the Zoom room now, I don't know what to tell you, but if you are in a Zoom room, you will get your questions answered, and we are going to light it up. So make sure you have those ready. We're going to do 20 minutes. We'll try to get in as many questions as we can. So make sure if you have something for someone specific, then please make sure to put their name on there so that we know who the question needs to be for. And if it's a general for the whole panel, you can just put a question in there. All right, you all. So we're going to go ahead and go to break now. We'll see you back in 5. Okay, we are about to start back for our Q&A. So welcome back everybody to our second annual Women's Health Awareness Symposium. And this is our mind, body, and soul. So welcome back from the break. So I'm going to look into the chat here and see, because I have to scroll now. There's I see a lot of high fives, a lot of way to goes. So, if you guys
Dr. Michele, I did text you.
Oh, okay.
We have 3 questions that were put in the chat. I sent you this on the break, but I don't know if you saw it. So there are 3 questions that were in the chat during the discussions.
Oh, awesome. Thank you so much. So you all, that wonderful angelic voice is Jennifer Wilson. So everybody give some love to Jennifer Wilson. She has been a phenomenal. Her, as well as my sister, Jennifer Clark, have been wonderful in moderating the back office to make sure that things run smoothly. So you all make sure to give them some love. So thank you so much for those questions. All right, awesome sauce. So we have one question here, and that is, let's see. No, I don't see the actual questions text to me.
I wrote them down, so I can ask them if you want me to.
Sure. Well, how about we do this? Well, let's go ahead and let Jennifer go ahead and ask those questions, and then we will get some answers to those questions. So, Jennifer,
okay, the first question is to Dr. Lippman. That question was, why are Black women targeted?
If you could spotlight Dr. Lippman so he can answer the question.
Black women disproportionately suffer with uterine fibroids. So they are much more likely to be impacted by things like surgery, hysterectomy in particular. And so they disproportionately suffer with these benign tumors. So the people that are in the hysterectomy business, and it's big business, it's a multi-billion-dollar industry, are targeting their audience, which is young Black women. That's why you see the diapers with the package on it's not an elderly man or woman, it's a young African-American woman, because they're the ones that are getting hysterectomies at young ages, like I mentioned in the talk. And so the point of my talk is that women are entitled to know all the options, not just the surgical ones. And hysterectomy should be stopped for these benign tumors. If you have uterine cancer, obviously hysterectomy is appropriate. And if you look racially, Caucasian women get hysterectomy for cancer, totally appropriate. But African-American women largely get hysterectomy for benign disease. And you can talk about the very unfortunate history, particularly here in the South. I'm in Atlanta, the horrible history of hysterectomies, from the Mississippi appendectomies to the Fannie Lou Hamers to the, experimentation and operation and sterilization of women of color here in the South. But obviously, women of color disproportionately suffer with these benign tumors, and UFE replaces the need for any surgery, any hysterectomy. You can get the relief of symptoms. You can avoid the risks and long recovery of surgery. And importantly, and often underappreciated, you get to keep all your parts and even have children. It's truly one of the biggest medical breakthroughs for women. Unfortunately, most women never hear about it because the gatekeepers of women's health, the gynecologists, want to operate.
Thank you so much for answering that. Thank you so much for that. The next question that we have is for Dr. Shalina Nevins. How can integrated health help children and parents? Can we spotlight Dr. Shalina? Is she here? Oh, okay, I see you now.
I'm sorry, did I miss the question?
Yep, no worries. Yep, so how can integrated health help children and parents?
So the beauty in that is that children and parents develop, so the parents are fully understanding why they're bringing their children, right? but the child is learning along with the parent how to start their healthcare journey, which we all get one at some point, right? How to start their journey with the positivity of asking questions, being prepared, not feeling defeated walking in. You are not the underdog when you come into an office. You have the right to ask questions, no guilt in doing so. And they get to see that and experience that, and they're taught that from the beginning. And that's the beauty of it. Even if they are the patient, the way that integrated care is, the treatment plans are created, that it kind of fosters that kind of care from the beginning for the children, while the parents also kind of switch mindsets and navigate into that.
Thank you. Thank you so much for that. Jennifer, can you give us another question from the chat?
Go to your question.
Sure. No
quick.
worries.
I want to
Yep.
make sure I got it from the right person.
Okay, no worries at all. Thank you so much for that. All right, so let's go to another question that we have. And actually, for Dr. Katrina D. Hall-Smith, did your health challenges interfere or impact your military performance? So I think the question was either did or how did your health challenge, how did your health challenges impact your military performance, if it did at all?
Thank you for that question. So it impacted at the time of diagnosis. However, it improved over time after I started to get treatment. And so one of the things that you can either be treated with medication or cognitive behavioral therapy, or the combination of the two. And so in my particular situation, I did do a combination of the two, because with ADHD, having more of a regimented type of structure to your route, or having a routine structure, helps you to be able to maintain your focus, as well as being able to taking time for meditation and being able to hone in on those things that are most important, and then setting the priorities to be able to get your mission accomplished. So it impacted, that was my wake up signal to me when I was in residency, that something was going on. But then after putting the right strategies in place, yes, I was able to continue on and progress, and went on to attain the other goals that I had set for myself. So
Awesome.
This
Thank you
is
so
a
much.
follow-up question for Dr. Katrina.
Sure. Mhm.
In addition to that, it says, do we suffer due to nutrition?
do we suffer due to nutrition? I mean, nutrition is going to play a role in a lot of different situations. Specifically, or I'm trying to figure out if they're asking about a particular vitamin deficiency or something like that.
That question came from a Grace. That's who put that in the chat. That was a follow-up to her question that you just answered about how did it affect your role in the Army. So that was a follow-up question from Miss Grace. So she didn't give any elaborate on a particular vitamin or anything. I think she was just asking like our overall nutrition. And is nutrition a factor?
I'm sorry, that question was for, I'm sorry, Dr. Hall-Smith. That question was for Dr. Littman. I'm asking so many questions.
Oh.
I didn't put it in the text.
But no,
so
you're
sorry.
good. You're good. Thank you. So that was for Dr. Littman. Do we suffer due to nutrition?
Well, with respect to fibroids, yes, there are things that you can do that will help. There are people ask me all the time, why do African-American women or women of color disproportionately suffer with fibroids? Some of it has to do with nutrition. As I mentioned, nobody knows where fibroids come from, but once they arrive on the scene, they grow with estrogen. So we talk to patients about how can you can't eliminate estrogen, but how can we try to limit the extra estrogen that your ovaries don't put out? So we get exposed to estrogen, as eloquently talked about earlier from Anthony. Estrogen is in the food, it's in the water, it's in the cosmetic products, it's As I say, hair relaxers used to be a big thing. It's not as big of a thing as more women are wearing their hair naturally, but the phthalates in hair relaxers, if you looked at it biochemically, it's almost identical to estrogen. Estrogen is produced and stored in body fat. And so the more body fat you have on you, the more stimulated these fibroids get from the extra estrogen. It's one of the reasons why African-American women disproportionately suffer, because they, in general, have more body fat than other racial groups. Vitamin D is really important. Vitamin D is one of the most powerful anti-fibroid growth hormones. It's actually a hormone. It's not a vitamin, but if you have a normal vitamin D, you are very unlikely to suffer with fibroids. But unfortunately, only 10% of African-American men or women have adequate vitamin D. And the darker the pigment of the skin, the harder it is to get adequate vitamin D. So when we talk, our consultations in our office last 45 minutes or longer, we talk about the things you can control. You can't control the genetics, because if your mom had fibroids, you're much more likely to have fibroids too, but you can't pick your parents. But there are things that you can do. Exercise. Try to either eliminate or limit hormone-rich foods like red meat, non-organic chicken, dairy. Increase colored fruits and vegetables, which have flavonoids in them that block an important enzyme in estrogen production. So eating healthy, losing excess body fat through healthier choices and exercise, vitamin D, these are things that we have some control over, and we try to stress that to patients to try to help with their fibroid symptoms. But unfortunately, many women come to me with the car already broken, and those sorts of things can be helpful, particularly on the path after UFE. But if we can start these things earlier in life, the car doesn't necessarily have to get broken.
Thank you. Thank you so much for that. And thank you, ladies, for sorting that out in the chat. And if we could, for just sake of continuity, if we can still remain muted and make sure that we continue to work those things out in the chat. So thank you all so much for getting that. And thank you, Grace, for your question and for clarifying that. All right. And I had there was a follow-up question about is UFE covered by insurance?
Yes, absolutely. UFE has been available for over 25 years now. So this isn't anything new or experimental. It's well proven safe and effective, and it's covered by all insurances, including Medicare and Medicaid. So insurance, as long as you have insurance, unfortunately, a number of women don't have any insurance because it's not affordable. But UFE is absolutely covered by all insurance carriers.
Thank you. Thank you so much for that. That's very important for women to know that there is an alternative, that you don't have to, depending on your insurance, you don't have to pay out of pocket or at the most copay. So thank you so much for that. And we did have another question. We had one for Anthony Martinez Bevan, and that was, what genetic testing do you offer? Uh-oh, did we lose him? Okay, well, no worries, no worries. All right, cool beans. So
yeah, I think he left, Dr. Clark. He's no longer in the.
Okay, no worries at all. All right, excellent. So I do have a question for you, Jennifer Perry. What are some daily practices to maintain a positive mindset? So important.
I always, and it sounds like you do too, start from a place of gratitude, just every day waking up and being thankful that you're, right now I'm like, hey, if I can put a foot on the ground and it's still working, I'm really thankful for that. So definitely starting every day from a place of gratitude, no matter what you're facing, and definitely no matter how small the thing is that you're grateful for. And just always be present in your life, no matter what obstacles are ahead, no matter what happened in the past. Don't worry about the future. Just be present in the moment and focus on the things that you can control. I know when we're going through things that I went through, it was just, I couldn't spend more time in the past of what my life was like or worried about what my life would be like moving forward. I could just knew that I had today, I had the steps in front of me to take, and I planned on taking them. And I always continue to move forward. Don't go backwards, no matter how little the step is forward. It's always progress over perfection. So that's just what I would definitely say. Start from attitude of gratitude. I think you said gratitude is your attitude of latitude or something. I'm like, oh, I didn't get a chance to write that down fast enough, but that was great. But literally start from a place of gratitude, focus on what you can focus on. Just definitely remember that you don't have to be perfect. It's okay to be imperfectly perfect. And just if you get to a point where you're going through something and you just can't go through it alone, because I know when things get hard for people, they tend to lose their support systems. And you reach out to people who can help you and support you. There are a lot of wonderful people that were on here today. So if it's a therapist or a coach or a counselor or somebody, just know that you don't have to go through whatever it is by yourself.
Awesome. Thank you so much for that. Yes. And, about the attitude, sometimes I just say things and it just rolls right off, but I believe I said something to the effect of attitude of gratitude determines your latitude, something like that, or elevate your latitude. So
you just need to walk around with like a little recorder behind you. You have all your, you can get all your moments.
I know, right? Jim Rohn says we have to write down write down all of our ideals and dreams, because we never know which one, right, is going to manifest and which one's going to make the biggest impact, not only in our lives, but the lives of others. So yeah, I have to do that. Absolutely. Okay. And we had another question for Dr. Katrina Hall-Smith. I don't know, Jennifer Wilson, did you have any questions yet? Or do you want me to read the one that I have?
No, you can continue because you read the other one already.
Oh, okay. Okay, cool beans. Awesome sauce. All right. And so the other question I had for Dr. Katrina D. Hall-Smith was after retirement, can you tell a little bit more about what you're doing now? So I don't know if there's somebody who's military based who would like to get a little insight or just want to know what you do when you talked about adult children and the company that you and your husband have together. Can you elaborate a little bit on that, Dr. Katrina?
Yes, absolutely. So after retirement and coming back home, we embarked in taking care of providing care for our parents. And so a lot of adults, and especially professionals, find themselves in that situation, whether they're in the same town as their parents or if they're away. And so as we were encountering different situations, trying to figure out healthcare, being able to provide additional modes of assistance for them, we figured that we weren't the only ones that were going through that. And so we wanted to be able to provide other people the benefit of our experience. So we've started a business now where we're calling it's this portion of the business, we're calling It Takes a Village. And basically, we are connecting people with the resources to help them in different situations as it pertains to providing care for your parents.
Awesome sauce. Awesome. Thank you so much for that. I was trying to, I think I had, let me check really quick here. And if that was another one for Anthony. So Pastor White, here's one. Pastor White, you talked about spiritual maturity and what that means for us in having it. What are some ways to obtain spiritual maturity?
Great question. So, there's a few different things that we can that you can do. First thing, right, is understanding yourself, right? So understanding what works for you. So are you a person who needs to meditate? Are you a person who needs to actually read? Or are you a person who needs to listen? Okay. And so in understanding that, then you can proceed from there with looking at how you consume information. So point in case that for me, what I realized again was, yes, of course I understand the Bible, but for me, first and foremost, it was the power of affirmation. And so, in understanding that I like the dynamic of using affirmative words, I begin to correlate that with scriptures, so that I go and look at the promises of God, or the confidences of God, as I call them, right? Some people may call them the I am statements of Christ, but just all of these things where Christ or God is constantly reaffirming who I am in him, right? I am the lender, not the borrower. Greater is he that is in me than he that is in the world. All things work together for the good of them that love God and are called according to his purpose. The Lord is my shepherd, I shall not want. I'm more than a conqueror, nay, and all these things. So just constant, and understanding how I myself liked to be inspired and where I wanted to grow, and so what I began to do again, just in my own time, was with understanding the power of that, with understanding the power of that, the importance of that. Then I begin to write those things down, so that I'm not just looking or hearing them, but then I'm also seeing them. I had the church go through an exercise where I had everybody write down these positive statements and place them in your car, place them in the bathroom, place them wherever, so that way you can also see it, so it can begin to sink in. So those are things that I believe, again, helps all of us.
Thank you so much for that, Pastor White. It's so important for us to be able to, when you talked about the affirmations, for us to be able to speak those things into a manifestation and walk into that as well, because as we know, faith without works is dead. So definitely, but we have to have the faith and the affirmations, put that out there. So that way we, again, when you talk about the shining light, I just thought about that again, just walking towards that shining light and then becoming it yourself. So thank you so much for that. I'm seeing some comments in here. So we had another question, and then I think we have another one maybe in the chat there. I see some things coming in, but another question was, this one was for Kimberly Willis, and that is, what is life like now after treatment? And I know that this question is near and dear to my heart, being a breast cancer survivor myself, so please do share.
Yes, life doesn't stop, so really, learning to pick up the pieces and continuing on and really adjusting to what I call the new you, because you're not the same person after you've had cancer. So just taking the opportunity to just look forward, to be able to adjust to the new medications if you have post-treatment, and to just to continue to keep on going on, continue to go with life as possible. Don't let anything hold you down with anything, and just to continue to move forward in that.
Absolutely. Thank you so much. That was it was a comment from Kathy in the chat that I was chuckling at, but definitely to keep moving. Like we talked about earlier, when you're going through something, don't stop. Go through it to the other side. So make sure we do that. So absolutely. So I believe there are no more questions. I don't have any more questions on my end. I want to give everybody an opportunity, all the speakers, to give an opportunity to do a quick, 60-second nugget. So what would you like for this? So if you had the opportunity to share one thing with the audience, what would you like to leave them with? And in addition, while the other speakers are speaking, please feel free to, again, put your contact information in the chat. I just, because one of the things was, Kathy said her 90-year young mother was asking, who's that? Who's that? Romans 8:28. So she knows her favorite scripture, her favorite verse. So let's make sure that we can connect with each other and put your contact information in the chat while someone else is giving their quick 60-second rapid fire. So let's go ahead and spotlight someone who would like to go first. You can, and then you all can just raise your hands and we'll pull you down accordingly. So go ahead and raise your hand, and then we'll have Jennifer Wilson to pull you down.
Can you just call them? Because I'm
sure.
still in the chat. It'll be easier that way.
Awesome. Thank you. Thank you for that
Thank you.
logistical information. Absolutely. 100%. Sure. So let's go ahead. First on my screen is Dr. Katrina Hall Smith. So come on down, Dr. Katrina, you are first for our 60-second rapid fire. What nugget would you like to share and leave with the audience?
You are your own advocate, and there's nothing wrong for asking for help.
Awesome. I love it. Great, great. All right, Kimberly Wilson, you are up next.
Got it. Dr. Katrina just took it. So I'll do another one. Really just to continue to fight and to never give up and believe in yourself and know that you can do it and make it.
Words to live by, 100%. Thank you so much for that, Kimberly. All right, Jennifer Perry, you're up next.
No matter what you're going through, you don't have to go through it alone. Make sure you raise your hand, reach out, and just understand that there are people that have been through things similar to you and can be there to hold your hand and walk you through it and encourage you along the way.
100%. You don't have to go at it alone. Thank you so much for that, Jennifer. All right, Pastor White, you're up next.
Feed your spirit, feed your mind, fuel your actions, and let God do everything else. All right. So feed your spirit, feed your mind, fuel your actions, and let God do everything else.
That's all you need. So thank you so much for that, Pastor White. All right, Dr. Shalina, you're up next.
Okay, stress less, love more, care more. That's my motto.
I love that. That just brought me so much peace in you saying that. Thank you so much, Dr. Shalina. Dr. Lipman, you're up next.
I would say no matter what your doctor is telling you, if you're suffering with fibroids, you don't need to have a hysterectomy. Get that second opinion, learn about UFE, get that second opinion from an interventional radiologist that performs these procedures. It's life-changing. Get that second opinion.
Awesome. Wonderful. Wonderful. Well, this does not yet conclude our second annual Women's Health Awareness Symposium. We do have something that we want to ask of you as the audience members. So bear with me 1 second because it's going to come with music and then I'm going to mute the music. So I want to pull this up because we want to hear from you. Your thoughts matter. So give me 1 second while I pull this up and then I'm going to mute it because it's going to come in a little bit loud. Actually, you know what? I might be able to, here we go. And then I think I can turn the sound down. There we go. Okay, awesome. So on the screen, you should see that there's a feedback survey. So for everyone who in attendance today, first of all, before we go into that, if you found value in our second annual Women's Health Awareness Symposium, Mind, Body, and Soul, please put so in the chat. If you're still watching on Facebook and didn't make it into the Zoom room, that's okay. Show us some love on Facebook, but definitely let us know that you receive value. And then you can also let us know you receive value with our brief survey. I know some folks who are QR code savvy, you can go ahead and scan that. If you are looking at this on your phone, to take a screenshot, and there's the link down at the bottom. So the link at the bottom is the same as the Scan Me survey. So for those of you who may be vision impaired, it is, you can take off the HTTPS, don't worry about that. bit.ly, so that's bit.ly/W, capital H, capital A, capital S, lowercase SURVEY 2024. So that's bit.ly/WHAS survey 2024. We want to hear from you so that way we can make our next symposium even more. I don't know how we're going to do that, but we're going to make it even more impactful. So we want to make sure to hear from you, get your input, and then that way we can integrate some of those things, even maybe some topics that you may want to hear next time. But we want to hear from you. So that's how you can pay us back. So you say, oh, this is an absolutely free seminar or a symposium. Absolutely, it was. And the only thing it's going to cost you was your attention, your time, and of course, your input. So thank you all so much for participating and being a part of this. We appreciate each and every one of you all. Thank you so much and have a super fantastic, super sensational day. And we look forward to seeing you at our next symposium. In the meantime, between time, take care. God bless. Speakers, please stay behind.